Hi, my name is Pete Bauer, and together with my colleague Sarah Cotterill, we've prepared these slides on the evaluation of the NHS Diabetes Prevention Programme, a research programme called DIPLOMA. In this presentation, we're going to outline the research that we're doing, try and respond to some of the questions that have been asked, and give people the opportunity to raise new issues and ask us questions at another time. What are the broad aims of DIPLOMA? Well, fundamentally, two major issues we want to achieve: to feedback regularly to NHS DPP stakeholders on delivery and outcomes to support the development of the programme, but also provide a rigorous long-term assessment of the effectiveness of the DPP in reducing diabetes in a way that is both cost-effective and sustainable. So who are we? Well, we like to think we're an experienced multidisciplinary team. We've got experience of a number of relatively high-profile evaluations that have been done in the past, the whole systems demonstrators, the evaluation of advancing quality, the expert patients programme, and the DPP demonstrators in the Northwest. And this is an independent and comprehensive evaluation commissioned by the NIHR, and it's separate to the evaluation of the digital diabetes prevention programme, which is being conducted by another team. We've got a lot of work packages within DIPLOMA. There's 8 in total, and today we're going to focus on 1 to 5 and 7. These are most relevant to the general audience. So work package 1 is about access and equity, and we're asking several questions, but fundamentally asking around inequalities. Do inequalities exist for the identification of eligible patients who come into the DPP? And we'll compare the prevalence in those at risk of diabetes from representative surveys to those who actually enter the DPP. We'll look at inequalities in referrals, who's referred and not referred, and also inequalities in completion, comparing completion rates of patients in different socio-demographic groups. And finally, we'll do the same for effectiveness, comparing the outcomes of different groups to see if patients from these different groups are achieving similar outcomes. Another important part of work package 1 is around the experience of patients and professionals in accessing the DPP. We're going to observe consultations where people discuss risk, interview professionals and patients to understand what they make of risk and how they decide about referral, and also interview eligible patients who've not been referred or those who've declined to understand why they've made their decisions. Work package 2 is around implementation, to see how the DPP is actually implemented at scale. We're going to ask about the barriers and facilitators to implementation in local areas by talking to local leads over time to see how the programme is developed, and also explore the implementation of the DPP in general practice, how patients are identified and how they're referred. Work package 3 is a really important work package that looks at service delivery and fidelity. And here we're going to take a really detailed look at many aspects of the DPP to ensure that what we think is being provided and what should be provided is actually being delivered to patients. So first, we're going to ask, do provider programs, the actual manuals they use, map on to the NICE and Diabetes Prevention Programme specification? And that's a coding exercise to look at what's actually in those manuals. We'll then observe training to see if the training of the staff who deliver the DPP addresses the appropriate content. Then we'll actually observe sessions, see if the intervention is delivered with what we call fidelity. Is it actually being delivered in the way that we want to see? And finally, to explore with participants, is the content, is what they've learned through those sessions understood? Do they understand what they're being taught? Do they understand the changes that they're being expected to make? So we're taking a very comprehensive look at the way the DPP is actually delivered. Work package 4 is around outcomes, and this is about how well do patients do who participate in the DPP, and how does that vary by service and patient characteristics. We want to look at this in detail, and we want to do this through an analysis of the data actually collected by providers. There's no comparator group in work package 4. This is just looking at people who've come into the programme to see their outcomes and how they may vary. That leads us neatly onto work package 5, which is around comparative effectiveness. As we said, work package 4 has no comparator data. It's just people in the programme. And work package 5 takes the challenge of assessing whether the DPP is actually more effective than usual care in reducing conversion of non-diabetic hypoglycemia to diabetes, eventually reducing the diabetes prevalence in England. Now, the rollout of the DPP makes a formal randomised controlled trial problematic, and so with Work Package 5, we're using routine data within the NHS and advanced statistical techniques to try and provide a rigorous estimate of the success of the programme in two ways. Does it reduce the conversion of non-diabetic hypoglycemia to diabetes, and does it then reduce the overall number of cases with diabetes across England? So we're going to leverage the major strength in the UK in routine data, as well as our local expertise around how to manipulate these databases to assess the impact of the DPP. And we're using a number of data sources, two major primary care databases, the Clinical Practice Research Data Link and Research One. We'll also use data from GP diabetes registers, and we hope to use the National Diabetes Audit as that data becomes available. Finally, Work Package 7 takes a number of inputs from previous work packages and brings it all together into an economic model to explore the short-term benefits of the DPP and the consequences of changes that we might see in the way healthcare is utilised by patients who've been through the programme, and then to go forward and think what are the expected long-term health benefits and consequences of the DPP. And finally, to provide the most comprehensive assessment of the overall cost effectiveness of the DPP compared to usual care. That means not providing this programme. We'll also look at issues to do with equity. Does equity considerations affect the overall cost effectiveness of the DPP? And also to explore what changes might be made to the DPP to improve its short or long-term effectiveness. Now, this builds on a model that's already been developed in Sheffield by the SHAR Group, but we'll be building on and developing and hopefully extending that model with new data and new findings to provide the most comprehensive assessment of the impact of this programme. So, as with all NIHR research, we have strong patient and public involvement in the programme. We've got 6 patient and public contributors, and they've already met 3 times, provide us with feedback and their insights into a wide range of issues. For example, discussing what the nature and the focus, the quality of research in Work Package 1 should be, what we should be examining in Work Package 4. They've also helped us develop an animation, which will help to explain more generally what we're doing in the diploma programme, so people, patients and the public can better understand what this research is doing and what we hope to show. So we had a number of questions identified to us in preparing this webinar, and we've tried to answer some of those now. So what is covered in the evaluation? Is it a quantitative or a qualitative evaluation? Well, it's definitely mixed methods. We've got quantitative and qualitative expertise throughout the team. But I think in terms of overall resource, the primary focus is on the quantitative assessment of outcomes. That's where a lot of the work's being done, because in some ways that's the most complicated aspect, trying to work out whether the DPP has had the effects that we hope. But there is qualitative research throughout, because we recognise the importance of this method to understand the experience of patients and professionals. Is user experience being explored as part of the evaluation? Well, again, to a degree. Work Package 1 will explore patient experience of access to the programme, because we think that's really important. Work Package 3, as we said, will explore what patients understand about having received the programme, what they understood was going on, what they think they need to do now to take things forward. We'll also use any other experience data collected in the DPP for our analysis. So there's definitely patient experience in the diploma evaluation. But as I said, the focus is really on the quantitative side. What's the assessment in terms of equity? Well, we've got equity considerations throughout the programme because we think this is a really, really important issue. We're going to interview people who do not attend the DPP to understand the decision making behind that. We're going to compare people who are referred and not referred to understand the sort of selection processes that are going on and any biases or impacts that might slip in. And we'll analyse the actual DPP data to look at the effects of the programme in different patient groups to ensure, or to at least test whether the DPP is achieving the sorts of outcomes it would expect in a wide range of patient groups. We're doing the work in a large number of sites. It's a national program, so we're looking at lots and lots of sites, and this slide shows the sites where we're focusing. So aspects of the work are being focused into these sites to give us the maximum coverage geographically, but also in terms of issues such as the different providers involved, and looking at the program in a number of different STPs. But remember, there are significant parts of the program which are going to use national data. So Work Package 5 and the related Work Package 7 will be using data from the entire national picture. So it won't be a partial assessment. We're going to try and look at a national picture wherever possible. What will be the workload involved for those sites involved in the evaluation, and what are the timescales? Well, we think most of the analysis is of national data. There is some research in local areas, which we've already discussed, but that will be a relatively small number of practices where we do detailed observation and interviews. We'll do some telephone interviews with DPP leads over time. We're doing a short postal survey about incentives in the DPP, and that's in all 44 sites. And we'll be looking at training sessions and DPP courses in 12 courses in different providers in detail. But again, in terms of the total number of courses being run, that's a relatively small number. So we don't think the workload will be significant for sites. And we're very, very happy to work with sites to make sure that's limited as far as possible. Dissemination of results and timescales. We will provide timely results to the national DPP team, and they will then cascade that down to sites. We can't really work with individual sites on this. We are going to work through the national team because they are have a framework to negotiate and discuss with local sites. We've already provided findings for thinking about the new DPP framework around the behaviour change methods and materials that are being used, around how the program has been implemented up to now, and issues to do with blood testing. So we're feeding back information as we go through. The final results on the effects of the DPP on health outcomes are not expected until 2021. And this is because of the size of the program, the complexity of those analyses, and of course the nature of the program means it takes a while for patients to go through in significant numbers, so that we might actually see the effects of the program in the analysis that we planned in Work Package 5 and 7. So they are quite delayed in time, but there will be other findings coming out throughout. So dissemination, we've developed a public engagement animation, which is now available, and people can look at or send or share with patients and the public to explain what we're doing here, why we're doing it, and what we're hoping to find. We also have a project page at the Greater Manchester Clerk website, which talks about the evaluation of what we're doing. We're also doing bi-monthly blogs. So we've had 4 blogs already looking at how it's being implemented, the experience of patients and professionals, and looking at issues to do with access. So we're hoping that these can at least keep people up to date with what we're doing, initial findings, and show the developments as we move forward with the programme. Is it a regional analysis, or only looking at the national picture? Well, the focus is on the national picture. This is an evaluation of a national programme. We can explore context in some work packages, but we're not planning specific regional analyses at this point in time. So the focus is very much on the national picture. What databases are we looking at? Well, we're looking at a wide variety, the National Diabetes Audit, the DPP minimum data set collected by providers. As we've said, the Clinical Practice Research Data Link and Research One. And for comparison, we're also looking at national surveys in representative samples outside the DPP, such as the English Longitudinal Survey on Ageing, Understanding Society, and the Health Survey for England. And they're really focused on enabling us to understand which sort of patients are coming into the DPP compared to these wider, more representative surveys of health in England. So just to indicate, our funders are the NIHR Health Services and Delivery Research Programme. We are very happy to receive messages or queries, and the contact for that is on the slide. We hope that this brief introduction has given you an idea of what we're trying to do within DIPLOMA and the various work package we are hoping to deliver. And of course, if people have got further questions that we've not answered by this, please contact us, and we will attempt to get answers to you to those questions as quickly as possible. Anyway, thank you very much for your time, and I hope you enjoyed this presentation.